Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to really just kind of have this more of an open forum tonight just to kind of hang out. I had a lot of questions yesterday that I didn't get to, so I'll try to get to some more questions today. And mostly just do this for about 30 minutes here. And I have a lot of cool cases tomorrow, so we'll see also who lets us share some videos content tomorrow. But I'm going to show this patient just as a backdrop. You could take a look and see really wonderful patient who originally didn't let me share results, but then loved his results so much that he was just like he was happy to share it. So really, really beautiful result, really impressive improvement over the course of about 6 months or so for this patient. And we did a few steps really for him. I'll go through and talk about that as more people join. And I'm seeing some people come on, and I see some familiar names. How's it going, guys? Looking all the people, familiar names. How's it going, Lucky Singh? Good to see you on too. Thank you, guys. And let's see here if I could get to some of the questions I had yesterday. Some people were asking regarding which kind of filler is the best option for scars. Someone was saying that they were confused about why sometimes I choose Radiesse, sometimes I choose Sculptra, sometimes I choose Bellafill. And I'll kind of walk through that thought process. This case, for this patient, I used, in his case, I actually used Bellafill. But I'll explain the reasons why. So some patients, I want to get a little bit more contraction really of the skin. So when I'm doing the treatments, I'm trying to get a little bit of skin tightening, and I don't necessarily have to do always like a little bit of filler. Like for example, in this patient for his jaw area, I tried to actually work on getting a little bit of skin contraction with the laser, and it looked like it got pretty good with that actually. The neck area was really an area where it's very difficult to use too much heat, too much energy. And so that's why I opted not to do too much filler at the time over there in the neck area, because I wanted to see just what would happen as we contract the tissue if we really truly needed volume. So I ended up not doing really particular much volume in the jaw area. But what I did do is actually some volume replacement in the cheek area. And I did that with Bellafill in this case. So I opted for Bellafill because most of his scars were these small boxcar scars, and he had some volume loss, some volume replacement in each of these individual spots. And I knew I needed to really support that tissue, even if he lost a little bit of weight in the future. I wanted to have something underneath there to actually make sure that we could continue to make some collagen, and he'll have something in his skin which is going to actually really be supportive. So it's awesome because we have that in this process with something like Bellafill, which for some patients, especially scar patients, it's awesome because you could just have, even if you lose weight, and he was planning on losing some weight in the future, we could just have something to support that. But other patients, when there's a lot more fat loss, we could maybe do something like fat transfer, or we could do Sculptra. Other patients where there's more laxity, I may want to do something like Radiesse, and that's another option because it could stimulate more elastin production. So that's sort of my thought process with a lot of things, and also the location of the scars. So I prefer really where it's like the temple area. Sculptra, Bellafill, those work out really, really well. The cheek area, we could do Radiesse could work well, Sculptra could work well, Bellafill could work well. And someone's asking, do you do Botox or Juvéderm? I don't do Allergan products in general. I don't do, so I never really had a good experience with them as a company. And so I just never do them. I find that almost, I would say maybe like 9 out of 10 cases that I dissolve, I do a lot of dissolving, and probably 9 out of 10 cases are Juvéderm. And so it's, a lot of times people will say that it was okay when initially, and then it shifted, it moved. And a lot of people will say Juvéderm, Juvéderm, because it basically just kind of like shifts when it draws in too much water. There's this thing called Vicross technology, which really is really stubborn a lot of times. It almost feels like a permanent filler, and when it shouldn't be a permanent filler. It doesn't give us the benefits of a permanent filler. It doesn't give us like anything with, collagen stimulation or enough of collagen stimulation to be worth it. So it's not a great product in my mind, and I think that they really were like dismissing the complications that they were having with it. So I never really loved it. And I prefer more like the Restylane line of products, like the Galderma ones. So I use Dysport, I use Restylane Classic for like the tear trough area, and I use Restylane Define, and those are kind of like the ones I use for hyaluronic acid fillers or Kiss in the lips. And then I also do like Sculptra, which is also Galderma. And then for really for other things, I use Bellafill. I use a ton of Bellafill, and sometimes I use Radiesse also. How much is your subcision treatment? So usually it's about, well, it depends really, but it could be like 800 to 1200 for a lot of patients. If there's excisions, it could cost more. If it's more complex, it could cost a bit more, but around that is for most patients there. Melly Elephant is saying, is the jawline hard to work on? I always see them looking the less better than other spots. Yeah, absolutely. That's what I was referring to. You just can't use too much heat, too much energy in the jaw area. So I actually wanted to showcase that for you guys because it's really difficult to get full contraction. The jawline does respond better though to things like phenol peel actually. So this actually could be someone that we could do a phenol peel on if he has the downtime, if he's okay with it. Yeah, you know, if I recall from my conversations with this patient, he doesn't have those type of things. But at some point, if he wants to, if it really bothered him, we could consider doing it. But you know, he's very happy in life. He's very happy with the progress that he's been making in a short period of time. Just after a few months, really, we got this a significant improvement here. So we'll continue to get better improvement. And at some point, if he, you know, and we want to do more resurfacing, things like that, I think we'll get better and better results, which would be awesome there. How many times does one usually need subcision? So in the like the cheek area, usually just a single time. Sometimes the lower part of the face, because I don't use blades really in the lower part of the face. I should say more like the tailor liberator. I typically don't use in that area. I can use maybe small little needles or so, or even a Noker needle sometimes. But it could still be stuck a bit there. So sometimes you may have to repeat it in the lower part of the face. Also in the forehead area, I may not actually necessarily do it there. So those are different areas that I may not necessarily do blades, and so we may have to do that again. It's usually blunt cannula is enough, but that could end up being the case. If you guys are able to share the live, by the way, for some reason they shadow banned me again, and you know how I was like not able to go on for like 30 days for a little bit. If you could share it, I don't know why they did it that actually. I don't know what they did. I've been actually just following their rules that I've been trying to do. I'm not sure what they're doing. Not going to lie. I've wondered if I fall and scrape skin off my face, maybe the scars will leave. Maria, yeah, there is a thought process with that. Really, we could do something like dermabrasion, which is sanding it, but it's like very carefully as we're sanding it. And sometimes I can even do that when I'm doing a laser. The other day I had a patient with very thick scars, and he was a patient of Asian descent, but lighter skin tone. This was actually the third time I was working on him, and there's still this bit that was still relatively thick. So I used a laser, and then I did a dermabrasion on top of it. So I actually literally used sandpaper, and it was just mechanically smoothing it down like that. Now it's going to be very smooth. And sometimes you could do it, especially for patients who we're very sure are going to be very good with sun exposure. He works, but he's indoors. He's very careful with sun. He hasn't had any complications with pigmentation ever since I've been working on him, and it's going to be awesome. So it's more like a finishing touch in his case. It's going to be really great. Lucky Singh is saying, "Hi, Dr. Qazi. How old is this patient? Does older skin require anything different?" It's this patient's in his 40s, I believe. So it's not that necessarily it requires like too much different. It just could take a little bit longer for that collagen response sometimes. So this is about 6 months out. We did do 2 steps for this patient though. I did do the bigger combination session, including subcision, and then I did do another laser session for this patient in between that time. So he did do 2 steps actually. So we have 2 sessions over here in this case. Yes, I'm in like some sort of social media jail again somehow. I don't know what I did, what crime I committed. They don't even tell you. Just they put you in the social media jail sometimes. So yeah, if you guys could, appreciate you, Sailor Moon, for sharing the live. If you guys could just help me get out of jail like you did last time too, that really helped out. I don't know what happens sometimes. Maybe the laser companies don't like sometimes what I say. Lucky Singh is saying, when is your birthday, please? And many of us would like to say happy birthday. You're doing so much for us, the least we could do. I appreciate you. It's in August, actually. So I appreciate you. Thank you so much. But I'll let you know when it's my birthday time. Thank you so much. So honestly, you don't, I appreciate the happy birthday thing though. But I'm happy to do these things too. Like I'm glad it's like useful and valuable for patients and people all over the world. Really, it's really, really nice. Actually, really nice. On all these different platforms, I have people from all over that just at least listen and like at least they know now when they go to somebody what makes sense, and like at least you could think like twice if somebody's trying to trick you on a package. This poor gentleman was tricked on a package actually. Before he saw me, and I forgot how many. I think maybe 10 or so, something like that. I got to ask him when I see him again. But a lot of lasers or microneedling, all that kind of stuff, and really unfortunate here. And it's like, I want everybody to know at least what's going on. I want people to know that like there's a way that like you should be doing this. There's very few people that do it at a high level, but at least you could know that like, okay, you see what I'm talking about, and clearly there's a way to do this. And this person's claiming that they could get results with like 10 microneedling sessions. I think you should probably really think twice, especially if your scars look like the before photo. Like really, you should like think about it like, man, this just doesn't make sense. This guy I saw on here is like always talking about how that stuff isn't going to help for this, and this patient did a bunch of this, and so it's like maybe I shouldn't purchase this $3,000, $6,000 package. I don't know, sometimes it's $10,000 packages that these guys are doing. And it's like really, really crazy actually that they do this to people. They do it and they don't know what they're doing. They do this and they're like putting people, through all this pain, all this suffering, and they're not getting results, and they're continuously doing it. And they think that this is like, what matters is that they can make money off of it. And if they don't make money, someone else is going to make money off of them. So they might as well do it. There's actually people that think that way. There's people who think that if they do, if they don't do this, if they don't basically get that patient's money right now, they're going to go to somewhere else and someone else is going to do it, and like they may as well just do it. And it's like terrible. It's like a terrible, terrible mindset actually. That's why like this money world is just really just destroyed so much of it. Like it's just destroyed. It's become so toxic, and it's like just like sometimes terrible thing that actually has occurred in this world where people are just obsessed over and over and over again. So it just poisoned everything that it touched actually. Melly Elephant is saying, I paid for a consultation, but then I cannot book an appointment. I will try again. Well, if you could email our staff actually at info@Qazi Clinic, because unfortunately I don't know your name from this, but if you could email them, they will be happy to. They've set it up all day long actually for people that book it. So I'm really sorry that that did not happen. We absolutely will go forward with it. And if you could actually let me know when you paid that consultation, I'll let them know too, just in case you can't email them. And then we could go back and see where the consultations were. But, we definitely would be able to help you with that. Danny Boring is saying, I live in North Carolina, but really want to see you. How does doing a treatment plan this far away for a faraway patient work? My patient yesterday came from Arlington, Virginia. I have patients from all over the world, actually. So I'd be happy to help you. Absolutely happy. Most of my patients come from out of state, actually. A lot of them also come from North Cal. This whole week was actually from like SF and San Jose, Walnut Creek area. So really, really comfortable with doing virtual consultations. Really, I'll show you all the different things that are there and all the different kind of scars you have. And then we'll like zoom in and showcase really how we're going to solve it for you. So I'll be absolutely very, very able to do this for you and comfortable doing it for you. When you come in person, you actually, especially since you're on the East Coast, you could just spend a night, but you're not forced to. Like my patients that are coming from over here, one of my patients drove in from Vegas, drove out back today. So that's okay. You could do that. I don't mind if you do that. We can manage the aftercare just remotely as well. But if you want to spend a night, just feel free to spend a night. I would be happy to take care of you. And when you're here, we'll be we'll work on this. I take care of these scars from start to finish. Someone has a Silver Surfer's on over here. I love Silver Surfer. Hopefully, Silver Surfer is like one of the best. Honestly, I don't know if you guys. It's like he's a very underrated character. Actually, he's really, really cool. He's almost like kind of like a galactic, like a universal, like Jesus Christ type of like allegory. He's really cool actually. It's like very much like about like peace and like I love him. He's like kind of like my guy actually. But I saw that name on there. I thought that was cool. Someone has Silver Surfer on here. Shiraz is saying, hi, Dr. Qazi, I'm getting Bellafill after 1 month after CO2 and subcision for my rolling and boxcar scars. In your experience, have you seen any side effects, and how many syringes are required usually? Well, you have to go really slow with it. You really, really do. It really does require a lot of volume, though. It's a very soft product. It's not something you could just do and like just one time, really. You know, it's really not. It definitely stays there, like 20% does stay there, but it's very, very soft. What I mean by soft is that it just doesn't give much lifting effect. It's something where you place little micro droplets in little spots. I always just do little tiny micro droplets, and then you wait, see how the collagen, your own collagen, grows around it, and then eventually you could do it again. So that's typically what I end up doing with it. And it depends. I'm not sure how much volume loss you have with it, but it's like in the mid cheek area. Usually I do like 1 and 1 on each side, and then we'll wait a little bit of time, and then potentially just like another one, and then potentially another one. So maybe about like 4 on average for patients in their 30s or so. You're in your 40s, you may need 4 to 5. You're in your 50s, like think of it like that. You may need 5 to 6 or so. It depends kind of like how much volume loss there is, and you don't do it at all at one time though. So Melly, we'll take care of that then. Melly's saying that you booked a virtual yesterday, and we'll set up the appointment for you very, very soon. So don't worry, we'll talk to our team to make sure that gets done for you. Gap Tooth Dummy saying, hello, Dr. Qazi, your patients are lucky to have you. Love these results. Appreciate you, Gap Tooth Dummy. Appreciate you. I'm not sure why you said Gap Tooth Dummy though. That sounds like, I know he's probably being a little bit funny, but I feel like bad saying that actually though. J4D is saying, hi, does Pico laser help with acne scars? In Greece, doctors don't do subcision, so it's only lasers and microneedling. Pico does help a little bit with scars, a little bit, but the problem is that it was pushed so much as something that works for scars, and that's why I'm kind of hesitant to like say it. There's like a way to do it that it could help with scars, but especially like the Pico, sure, really you could do it that way a bit of resurfacing with it. But it's something I'm kind of hesitant to push because the way they marketed it originally was as like almost like a scar treatment too. Like that was one of the things that they were like pushing everybody to do, and it wasn't great for scars. It's fine. You could get some improvement for scars, but certainly not like first line treatment. And you're saying in Greece they don't do subcision, and that's fine. But like there's places that you could go to that potentially would do subcision for you if you need subcision. Or consult with me. I treat patients internationally all the time, and I'll be happy to help you. We're right by the airport too, so I could or at least we could go through and talk and see kind of what the best options are for you. Lincoln is saying, is it smart to do subcision in an area that you have had filler or Sculptra? Well, it depends. So usually filler or Sculptra, it's okay. And typically it's not going to cause much of a problem. But like my patient yesterday, actually one of the patients that I had, they had done the Sculptra all around the scarred area. So it was tethered and stuck. And even like she said, when the injector was injecting it, she was saying that it was so stuck there. So she was putting the Sculptra around it. And then it basically was volume around the scar. And there was like this bit of a donut effect. So we still had to do subcision to break up that scar tissue. And then I placed a little bit of Bellafill in those spots there. What do you recommend for pore size, CO2, microneedling? Well, that really is just more about oil control. Definitely want to control oil. And with that, with like the topical retinoids, you could do oral medications like isotretinoin. You could try something light like niacinamide, could potentially help a bit. But sometimes you may have to do things like really a little bit more aggressive. Also, the Cure laser also could help because it reduces the oil gland. And then I had a video on there actually on these platforms. It showcases how a lot of times people think they have pores, but it's actually scars. And the scars that we have to treat a little bit differently. We do TCA Cross with that. We could do aggressive lasers for that. And that can be solved a lot better actually if it is scars. So take a look and see if it's thicker, it's probably actually really more likely to be scars rather than pores. And we could do things like TCA Cross then for that. So that's probably what I recommend there. Devin Shroy saying, as a person of color, I'm worried about the pigmentation. How do the treatments pan out for brown skin for scarring? Well, it's a really good question. Actually, the vast majority of patients are Fitzpatrick 4 and above. Vast majority. At this point, it's probably 90-something% of my patients now. So very, very comfortable with it. I just did a follow-up today on a patient. I think she ultimately may let me share. Her results are killer. She's a patient of Indian origin, and 2 months out, she just has no, like her pigmentation. She had hyperpigmentation before. She has no pigmentation issues at this point now. Her previous pigmentations already been cleared based on what I did. So it's very, very doable. It's just about the way I do it. I don't use bulk heating. I don't like heat areas that don't need to be heated with a lot of energy. I can use a lot less heat, less energy, and I do a lot more with manual type of tools. So I use things like Subcision. I do things like TCA Cross. I can do volume replacement. All those things can improve the scars significantly. That's what I would recommend, to be honest with you. And yes, we could still do lasers. I saw someone on here was also saying they're African skin tone. The same process, we still can do lasers actually, even in African skin tone. I actually even do sometimes ablative CO2 lasers in African skin tone. It sounds, like people will say, well, that's like, you just can't do it. You can do it. It just has to be the right patient. It has to be like the right kind of scars. You have to be super focused and super careful as you do it. And I am. And I'm very, very careful. I don't run into problems with it that way. I actually just followed up with like last week on a patient that I worked on about 2-3 months ago also. She flies in all the way from Atlanta, and she had very, very thick scars, African patient. And, we had a long talk about it. I was like, there is a risk that you could have pigmentation issues. And she's just like, these scars are so severe, so bad that like, and I trust you, and I know that you're going to be careful with it. But if it happens, it happens. And usually it is true that it is temporary, and it does repigment. Her pigmentation's fine, and it's totally fine actually. Her pigmentation she had before, the hyperpigmentation, is even better. So there's not loss of pigmentation, not darkening of pigmentation. In fact, some of the darker spots actually are better. So there's a way to do it. Patients have to be extremely, extremely good with sun exposure, And I mean like just using sunblock constantly, like every hour. They're really doing that. Like some patients, I tell them to wear the visor, wear a UV visor, do those things. You could take something like oral medication, like Heliocare could work as well. So that's something like, it's like a herbal supplement that helps as an antioxidant when you have UV damage, and it could help prevent you from getting pigmented from that. So those type of tricks are kind of what I'm doing, and also prepping the skin a certain way so that we can do it safely. But the biggest thing is that I just don't use much heat and much energy. And so you and I will have that talk, like you'll decide how much risk tolerance you have. Are you okay with a little bit of pigmentation issues? If you're not, that's okay. We could come up with another treatment plan. It may take a little bit longer. We may not be able to get to exactly what you're trying to achieve, but it's okay. You could decide on what option, what things make sense for you. And there's ways of doing it still. We don't have to use much heat then for you potentially. So just because you are, a darker skin type, you have melanated skin, should not mean that you have to suffer from acne. It should not mean that you have to suffer from scars. It shouldn't. It's just like that whole era just needs to be gone. And if anybody's telling you that, you really need to look at this and say that, okay, that's good that that person didn't do the treatment on you. That's true. But there's people like myself that do it all the time. And it's like really 90-something% of my patients are Fitzpatrick 4 and above. And it's like a lot of patients 5 and 6, a lot of 5 and 6s. So that means, patients who are only tanning, and when they go out in the sun, they're not getting sunburned. And patients of Filipino ethnicity a lot of times, or South Indian patients in general, some certain Middle Eastern patients, certain Latin American patients. There's a lot of different variables, and it's okay. We can still work on this to be able to get this very, very safe. Even really people get tricked though on lighter skin types with Asian patients. I do so much with Asian patients, so many, and it's like tricky for people because they'll look at somebody who's of Korean ethnicity, and they are usually very, very good with sun exposure, use sunblock at a very young age, and people think that they are not going to get pigmented, not going to have a problem if you use lasers and energy devices, but you really could run into a lot of problems. And I get amazing, excellent, beautiful results in that particular population without much heat, without much energy all day long. So it goes to show that like the way that people were doing things, this like cookie cutter approach, no matter who's walking through their door, they just assume that you could just throw things at them like this, and it's just needs to be gone. It's just like this old dinosaur type approach. And we're the meteor, we're the asteroid, and it's just like crush that, destroy it. And it's just like we got to move on from all that. Do it safely, do it effectively, do it like reproduce this every single time, over and over again. It's really really, really cool to do that. Really cool. Just over and over we could do it. Let's see here. Isn't the hyperpigmentation easier to get rid of? Well, it's possible. Yeah, it could be easier to get rid of than the scars. Yeah, it could be. There's ways of getting rid of hyperpigmentation. So that's the thing, is like, I'm not particular, but patients may feel like the pigmentation is so bothersome for them. And I have to assess that. You have to talk to me about that. If that's something that like is going to bother you more than your scars, then we shouldn't do those energy devices or do things like that, because there's a big risk that you could get pigmentation for several months. I haven't left patients with that kind of issue, but there's a possibility that you could have it for several months. And it's, there's a lot of things we could do. We could do, Pico lasers, there's other creams we could do, peels, things like that. But it's like your risk tolerance for that, and what are the kind of events you have. So don't stress too much about those things. Instead, just talk to me. And if you don't want to do those things, that's fine. We could figure out another pathway maybe, and see what other things we could do to get you better, to still get you good results. Shiraz is saying, can you take low dose Accutane after Bellafill? Can I use Accutane and Chazirotec 1% together? Okay, so you could do low dose Accutane even while doing Bellafill. There's no problem with that. Accutane and Tazorac, though, I would not do at the same time. That's going to overly dry your skin, so I would not recommend that. Instead, I would probably do things like a sulfur-based medication like Dapsone. Jerry Lou's saying, hi, just had CO2 laser. It healed around 10 days. Then I went out with sunscreen for about 15 minutes. Now my skin is super red for 4 days already. I don't know if there is redness or pigmentation or not. It's likely a lot of redness. It's possible that it could turn pigmented. So I'm not sure if you're using something like a melanocyte suppressant. You should be on something. If you're Asian skin tone, you should really be on something potentially like hydroquinone. I don't use hydroquinone, but people have access to that usually. I don't use that much of it really. I don't love it. But what I instead do, you could do really more like pigmentation creams, things like that. Whatever you have access to, just try to do it and use it to be able to help out your skin, to protect yourself really at this point. The vitamin C, you're saying the only thing you're using is vitamin C and niacinamide. That's really not enough. You really should try to use some sort of anti-pigment cream, and talk to your physician who did the laser. He's really should have done that. Jerry Lou, I mean, you're based on your name, you really should be somebody that is treated so very, very carefully. We have to be very, very careful with your skin type. And you use a CO2 laser without the pre-treatment and then without the proper protocol. Go back to whoever did this and tell them that you really need to be on something now to protect your skin. Just to, take it so that you could actually jump at this so that you don't get that kind of pigmentation. A lot of people are just too cavalier with pigmentation, honestly. They're just too cavalier with it. Hi, DFit, good seeing you. Hi, Mrs. Jones, good seeing you too. Thank you so much for coming on again. Nikki saying, I have the worst scars ever. Please help. Is Morpheus the best treatment, and how long will I see it? Results. No, Morpheus is not the best treatment for scars. I would not say it's the best treatment for scars. Almost none of my results are ever with Morpheus, even involved a little bit. Sometimes it may be for like a little bit of skin tightening, but it's so rare for me to ever even mention it. I do Morpheus 8. I have it in my office. I do it for like skin tightening purposes. Although I'm really open to like other radio frequency microneedling devices, by the way. Like I'm thinking about it. Just there's a few things I have with the company otherwise, but it's not good for scars. It's not like anybody telling you that, and anyone trying to sell you that is doing you a disservice and is being potentially unethical. What about microneedling? So microneedling not going to help much for these kinds of. So this patient did a bunch of it. What's your thoughts on Banish Skincare's Dermastamp? I mean, it's fine it's at least it's Dermastamping, which is good. It's better than rolling. These are very, very thick scars though, very difficult to improve that. I do like the owners of Banish. I see them on the thing. I think that they seem like they're nice, dedicated type people. It's not going to hurt you, I don't think, like in terms of I don't know how painful it is, but it's not going to seem like it's going to make things worse. But I don't think it's going to help much for these kind of scars. That's for sure. It's really not really. These are much more complex. You need a lot more things. But if it's mild type of things, sure, why not try something like that? Sure. At least it's better than, like I said, the pens or anything like that. What do you think of eye gel from your own plasma? Well, as an injectable, that's fine. I wouldn't do anything topical like that. That's like you could have bacteria that just seeds on your blood. That's just a really, really could be a disaster around your eyes. Ms. G is saying, just joined. Did you do CO2? Yeah, we did do CO2, but the way I do CO2 is really different. I do it at localized spots, like those thicker parts of the scars. That's where I do the CO2 laser. And then I blended it with an erbium laser as well, and some of the what's called a fractionated form of the CO2 laser. And then I also did subcision, where I went underneath the scar tissue, broke up the scar tissue. I did TCA Cross, which is an acid I placed at the base of each individual scar. And then I also placed some Bellafill for this patient. This was with 2 of the bigger sessions of that. And I only did 1 subcision session, but I ended up doing some more of the laser, also TCA Cross for this patient. What's an eye gel from your own plasma, Easy Gel PRF? Well, you could do it as an injectable, but I know some people do try to do things topical with that. It's really, really risky in my mind because of the bacteria that can end up just living in your blood. I would not recommend that there. Amelia saying, I'm a student and have ice pick scars on my cheeks. Is there any topical treatments or minor treatments that are cost effective that you recommend? Yeah, you could do, just start with retinoid. That's an easy, cost effective treatment. Start with that. If that's not going to help you enough, then you could try something like TCA Cross, also really something that's not going to be really too expensive for you. So all options really potentially for those kind of ice pick scars. And Autumn, we may not be hiring, I'm not sure, but there's it's tough to say, but you could always just submit your resume just to our info@Qazi Clinic line. You can just send it over there, and then they could just forward it and just keep it over there, whatever position you're trying to look for, or whatever else. Micah is saying, do you use the Alma hybrid laser? I'm not a fan of that company. I don't use them. And they certainly don't have anything like that, that could do this. They don't have something. I use more of like these surgical tools that I could use. So I don't really do things that do anything with that company. Jay is saying, did you say retinol? Sorry. Retinol. You could basically get like something like topical, like different cream could work out well. So different is what I usually recommend because it's something over the counter now. It used to be prescription based for us in my time. Now it's over the counter. So start with that. It's awesome. It's a great option. Mix it with a little bit of moisturizer for the first week so you don't purge, and then eventually you could escalate it there. Are you ever in Australia, Dr. Qazi? I'm currently seeing Dr. Lim. I feel like you guys will be a masterful team in how you treat. Well, I appreciate you. I have no plans at this time in going to Australia. He's, I really do respect a lot of what he did to push the field. I really do. It sounds like a cool thing, I have my own busy practice over here, though. So I actually have some patients from Australia, though, who've come over, and some people even from New Zealand, actually. But I'm glad that you're getting treated over there. I'm glad things are working really well. Really, really happy, though. PK Farnsworth, good seeing you on, by the way. And thank you so much for all you do. When your patients are post-Bellafill with you, are they still candidate for laser with you in the future? Yeah, absolutely they are. Absolutely. Let's see. Shamans is saying, I'm Asian and prone to hypertrophic scars. Can subcision cause keloids? Well, it could if the way that someone does it isn't with enough really with tumescent fluid. So like lidocaine, epinephrine, those things actually could cause a lot more friction in there. And that friction could cause more inflammation, which could cause a keloid. So yes, that could potentially be if the person's not doing it safely. Nino99, I don't know what the question was now anymore because I thought I answered almost all the questions that I wasn't seeing. There was a bunch on different platforms that some of them I may have missed, but I thought I got them. Why do I not like Alma laser? So, it's interesting. Not to say like, I think actually the reps I've dealt with over there were actually kind of nice. You could take a look and see kind of like the statements that they make, things like that one day, if you're interested. And they really just, I don't find them too ethical. Nino saying, I used Juvéderm years ago. Can I use Bellafill in same spots now? Yeah, most likely you could. Yes, you could. Sometimes if you have questions about things like that, you could do an ultrasound just to see if you need to dissolve the Juvéderm. But the Juvéderm is very different. It's a hyaluronic acid based product, so it's drawing in water. And Bellafill is actually made out of cow collagen and something called PMMA. It's not drawing in water, so you don't really worry about that actually. So yeah, you absolutely could do that. I don't really worry about that at all. So I think I hit almost everybody's questions, but yeah, you really don't have to worry about if you're mixing hyaluronic acid filler with something like Bellafill, or someone, DFit is asking about Sculptra. So Sculptra or Bellafill, it's really your preference to like, do you want the longevity of Bellafill? Do you want it really more like 2 years? Either option's okay. If you want something with a little bit more robust volume, Sculptra is really good for more discrete, smaller spots, especially the lower part of the face. Bellafill is excellent, really good for that area. Hi, what's your opinion on phenol peels, and would this patient be a good candidate? This patient would be a good candidate actually for phenol peels. He just didn't have the downtime, the kind of recovery required for a phenol peel, but he could be a candidate for phenol if he opts to do that at some point. I did 2 cases last week or so, and it's something that's really reserved more for severe cases. It's something where it's like thicker thicker type of scars really, and it's like a lot of people ask me to do it, but it's not exactly the right cases. So it has to be the right cases, the right candidate, the right skin type too, for us to say that that's an appropriate way to do it. Jean Non is saying, will these scars be prominent after weight loss? Well, that's why I do believe that you could support this a lot better with things like Bellafill. But yes, scars are supported with fat. So if you're losing rapid weight loss, you could end up running into problems there. You could run into problems. The thing is that with these kind of scars, you really want to do like just, and this in general in life really, go slower with your weight loss. There's some people just do these rapid weight loss things, and then you really can get aged really quickly. You got like a lot of laxity then too. So instead just, I know even these guys, a lot of guys are like, I try to stay the same weight. I try to just stay like fit, but there's a lot of people who bulk up and then just like, they just basically just try to get really toned in the summertime, things like that. And it's like that kind of weight fluctuations, it's causing laxity in their skin. So I'm not a fan of that kind of stuff. I like just keeping it really like about the same weight, like always. And if you are a little bit overweight, then just go slow with it. Just go slow with that weight loss there. So I would absolutely recommend doing it that way. But because if you do have rapid weight loss, you can get more loose skin, and you have like that fat loss that's right there like that really rapidly. It's just, it can make your scars more visible, and you may have to support it then with something like Bellafill, for example, or anything like that. What Fitzpatrick am I? I think I'm close to your skin tone. So Melia Elephant is saying, what Fitzpatrick are you? And I think I'm close to your skin tone. So I treat myself, I'm technically about a Fitzpatrick 3. I burn like really easily in the sun. I burn first before I tan, and like I just got tan right now today, like the last few days, because when I work out on like the rooftop, it's like sometimes it's like ends up just, even with sunblock, I still get a little bit burned. So it's really easy for me to get burned. And so typically that's not somebody who would say it was Fitzpatrick 4 and above. But I would still, if you were like my patient like myself was in front of them, I would still treat as a Fitzpatrick 4. You have to err on the side of caution, otherwise it's like, I do clearly get tan over time. So it's like I burn very easily, but I then ultimately do get a tan. So I would treat myself, if a patient like myself was in front of me, as a Fitzpatrick 4. So if that makes sense for you. And a lot of patients, a lot of actually Hispanic patients also have similar type of skin tone as me. And I typically would treat it as a Fitzpatrick 4, but sometimes they only get tan, and I have to treat it as more of a Fitzpatrick 5. So that's important really when it comes to like things like energy devices that are particularly good for like redness or pigmentation. Really critical that we pay attention to that Fitzpatrick scale for that. Tattoo removal, all those is really critical. Can you get biostimulatory fillers on top of fat grafted areas like under eyes? Yeah, you gotta be very, very careful in the under eye areas for biostimulatory products. Usually don't want to go directly in the under eye area for that, but around it, yes, you could do it. Even over the fat, it's just your own natural fat then, so it's absolutely possible to do that. All right, guys, I have a bunch of cases tomorrow, like really, really cool cases. And yeah, I don't know why I'm in social media jail. So if you could like share my profile and stuff like that, that'll be really, really helpful. Like we got rid of it last time. I don't know what they did to me this time. They didn't even give me any warning. I mean, it was great interaction. I'm not saying anything like that. It was a great interaction, but I don't know why they did that to me again. It's like we were getting, a lot of movement there, and then suddenly it just, they put me in, they locked me up again. I don't know. Who knows? Hopefully it's not like a gulag at some point one day because of the stuff we say on here. Let's see. I heard you should wait 6 months if you're switching to another biostimulatory, PDLA to PLLA. No, you don't have to do that. You could just do it really in certain areas, depending on how you're doing it. You don't have to wait 6 months, but you do want to be careful with it, of course, but you don't have to wait 6 months. Depends on how people do it and things like that. But I appreciate you guys. I really do appreciate you. I will be back on Monday. I'll see you on Monday. We'll see what happens tomorrow too, with what kind of cases, and if anybody lets